many African countries are already feeling the impact of India's deadly second wave of the coronavirus pandemic. Last month, India halted the export of Covid-19 vaccines to deal with its crisis, causing delays in deliveries and vaccination programs in many African countries. Malawi has destroyed thousands of Covid-19 vaccines due to late delivery and logistic challenges. Countries like South Sudan and DRC may face similar challenges if they are unable to distribute their stockpiles before they expire. African countries remain the lowest recipient of Covid-19 vaccines, with just 18 million doses distributed in a continent of 1.3 billion people, according to the World Health Organization. In the meantime, the health body and the Africa CDC have advised African countries not to destroy their expired stockpiles, saying they are still safe for another 9 months. Now, Dr. Amitaka is the chair of Africa Healthcare Federation. He joins me from Nairobi, Kenya. Thank you so much for joining us. Let's start with your thoughts on administering expired Covid-19 vaccines as advised by the WHO and the Africa Center for Disease Control.
Yeah, you see the stockpile that you mentioned to go beyond the expiry date. I think the scientific data on ensuring we don't destroy it now is the right advice. With the global shortage of vaccines, and if you have an effective vaccines, and we know all medicines with an expiry date, all have an extended period of time from the date is written expiry. So if we can save lives and livelihoods on giving some vaccines that will be scientifically stable, we should definitely do so. So I fully agree that we should not destroy expired stockpiles that may be with us awaiting scientific indication on how to use them.
But some people do say that administering them, or at least keeping them, could negatively impact vaccination programs in Africa.
Absolutely, and that's why I say the scientific statement would be important. Even the insurance and indemnity would be important. I know I would be extremely guarded about giving an expired vaccine, and by chance you have either a complication or a fatality, you will have a double problem in the hands of many governments and ministries of health in Africa. So I think it's with extreme caution, with a scientific statement, with an indemnity clearly outlined before those vaccines are administered.
Well, with delays in vaccine distribution comes the fear of an India-like situation. How likely is this on the continent?
It is extremely scary, and if you have seen this allegedly reported case in Uganda, Kampala yesterday, and it could be genomic testing going on to confirm whether it's an India variant. So many countries have suspended flights from India, and maybe rightly so, unfortunately. The answer to your question, it's extremely scary. And it's extremely likely because we are really good friends across the Indian Ocean between India and Africa.
Well, thank you so much for your thoughts, Dr. Amitaka. That's Africa Matters. Thanks for watching. I'll see you next week.